Another technology solution we utilize is called the Simplant Software system. In the early 90s, when we would use CAT scans to plan dental implant surgery, the CAT scan was just read on a piece of film. It wasn't interactive. So we would hold it up to a light box, we would take our measurements so we could know how much bone was there, but there was so much information locked in that CAT scan that we couldn't access because we had to look at it on a piece of film. As software developed and computer power developed, Simplant Software came into being. And Simplant Software allows us to load a patient's CAT scan data onto a computer and then interact with that CAT scan data. So we can not only take measurements, but we can place the implants virtually. We can do virtual implant surgery. That allows us to fine-tune what implant to use, the dimensions of the implant. It allows us to analyze the density of the bone surrounding the implant so we know how long we'll have to wait. We'll know, is that bone adequate to support the dental implant? And then the next step in Simplant Software is what's called guided surgery. So once we have the CAT scan on the computer, we can place implants in the software, and then that information can be transferred to a guide. And at the time of surgery, that guide is placed in the patient's mouth, and there are holes in the guide. We drill directly through those holes and place implants through those holes in the guide. And the guide and the software and the cone beam scanner are so accurate that those implants are placed within a fraction of a millimeter within the patient's jaw where we place them in the software. And by using guided surgery, many times we don't even have to open the gum. We can do what's called a blind procedure and place those implants right through the gum. So imagine using guided implant surgery, having a whole arch of 6 or 8 implants placed in 30 or 40 minutes and not have one stitch when you're done. It's really tremendous technology, and our patients really appreciate it. I urge you to call my office to schedule an appointment for a consultation. We can discuss how implants can help you achieve your oral health goals so you can smile better, feel better, and enjoy life more.